Welcome to day 26 of your CPC Exam 30-day prep series by KS Medical Coding Academy. Today, we'll begin our ICD-10-CM coding journey by understanding its structure, components, and rules for building valid codes. This is based on the FY 2025 ICD-10-CM guidelines, effective from October 1, 2024. What is ICD-10-CM? ICD-10-CM stands for the International Classification of Diseases, 10th revision, clinical modification. It's developed by NCHS and CMS and is required for use in all U.S. healthcare settings. It classifies diseases, conditions, and reasons for encounters. Coders must follow this standard under HIPAA. Structure of ICD-10-CM. Each ICD-10-CM code contains 3 to 7 characters. The first 3 characters form the category. If more detail is needed, the code is extended with a 4th, 5th, or 6th character. A 7th character is required for certain chapters, like injuries or obstetrics, to describe the episode of care. Example: code format. Let's take the code S06.0x1A as an example. S06 represents an intracranial injury. 0x1 adds detail. Here it indicates a concussion with brief loss of consciousness. A, as the 7th character, tells us this is the initial encounter. Notice that X placeholder, it helps maintain the 7-character format. Placeholder X. The placeholder X is used when the code needs to reach 7 characters, but the structure doesn't yet have 6 characters. This is common in categories like poisoning, injuries, and certain OB complications. Without the X, the code would be invalid. Use of 7th characters. The 7th character gives information about the episode of care. A equals initial encounter. D equals subsequent encounter. S equals sequela, or late effect. These must always be placed in the 7th position. Use the placeholder X if needed. Alphabetic index versus tabular list. Always start in the alphabetic index to find the condition, but never stop there. Verify the code in the tabular list. The tabular will guide you on laterality, exclusions, and if a 7th character is required. The exam often tests your knowledge of this step. Conventions to remember. Understand the symbols and punctuation used in ICD-10-CM. NEC means not elsewhere classifiable. Use this when no specific code exists. NOS stands for not otherwise specified, used when the provider doesn't give more detail. Brackets, parentheses, and colons all have specific uses in the code lists. These appear often in CPC exam questions. Code specificity is mandatory. Always code to the highest level of specificity. For example, if the documentation includes left or right, you must report the code with laterality. Codes that require a 7th character must be completed accurately, or your answer will be marked wrong. FY 2025 highlights. The FY 2025 update continues the same format but emphasizes precision. You're allowed to use documentation from other clinicians for certain elements, like BMI, ulcer staging, coma scale, and social determinants of health, but the diagnosis must still come from the provider. Summary. To sum up, ICD-10-CM codes are structured, layered, and strict. Always use both the alphabetic index and the tabular list. Use placeholder X and 7th characters as required. Code to the highest specificity. With practice, you'll master this section of the CPC exam. Coming up tomorrow. Tomorrow is day 27, where we'll explore the official ICD-10-CM guidelines, Part 1. We'll cover conventions, excludes notes, code first, and use additional code, instructions, and more. Be sure to subscribe and join us. Welcome to day 27 of the CPC Exam 30-day prep series by KS Medical Coding Academy. Today, we're diving into the official ICD-10-CM guidelines, Part 1. This section builds your foundation as a medical coder and is a guaranteed topic on the CPC exam. What are the ICD-10-CM official guidelines? These guidelines are created by CMS and NCHS. They guide coders on how to apply ICD-10-CM codes correctly in all healthcare settings. They must be used alongside the codebook, and following them is required under HIPAA. Guidelines take priority. Remember, the conventions in the tabular list take precedence over other instructions. The guidelines apply to inpatient, outpatient, and professional coding. They are separate from captain guidelines, don't mix them up. Key terms, NEC and NOS. Let's clarify two common terms. NEC stands for, not elsewhere classifiable, and is used when the documentation is detailed, but no specific code exists. NOS means, not otherwise specified, used when the documentation is too vague for a more specific code. These show up often on exam questions. ICD-10-CM conventions. Conventions are symbols and grammar rules built into the codebook. Brackets show synonyms or manifestation codes. Parentheses contain non-essential modifiers, these don't affect the code. A colon means the phrase is incomplete and needs more detail. The word and means and or and with means associated with or due to, unless the guidelines say otherwise. Excludes notes. Excludes one means the two codes can't be reported together, they're mutually exclusive. Excludes two means both codes may be reported if appropriate. On the exam, if a question includes an excludes one note, never choose both codes. Etiology, manifestation convention. Some conditions require two codes, one for the cause, and one for the result. Example, dementia due to Parkinson's disease. U code G20 for Parkinson's, and F02.80 for the dementia. The code first note appears at the manifestation code. The use additional code note appears at the etiology code. Code also note. The phrase code also tells you two codes may be needed, but doesn't tell you the order. Use coding logic or follow encounter sequencing. These are often tested in multiple choice format. Laterality and specificity. Many codes specify right, left, or bilateral. If documentation doesn't say which side, assign the unspecified code. FY 2025 guidelines allow you to use documentation from other clinicians for things like laterality, BMI, ulcer depth, and stroke scale. Other general coding rules. Always locate the code in the alphabetic index first, then verify it in the tabular list. Only report a code once per encounter, even if it applies to both sides. Use all required characters, especially 7th characters for injuries and OB codes. FY 2025 updates. This year's update reinforces 3 key rules. Coders can use certain documentation from non-physician clinicians. Use unspecified codes only when no more detail is available. Only the provider's diagnostic statement counts, not clinical criteria used to make the diagnosis. Summary. Today we covered core ICD-10-CM rules that are essential for coding and CPC exam success. Always follow conventions, recognize when two codes are needed, and respect excludes notes. Precision and attention to detail are what make great coders. Coming up tomorrow in day 28, we'll move into chapter-specific ICD-10-CM guidelines. We'll break down rules for coding infectious diseases, diabetes, sepsis, neoplasms, pregnancy, injuries, and Z codes. Make sure to join us. Welcome to day 28 of the CPC Exam 30-day prep series by KS Medical Coding Academy. In this session, we'll focus on chapter-specific ICD-10-CM guidelines, which make up Section IC of the FY 2025 official coding rules. Let's walk through key chapters that appear frequently on the CPC exam. What are chapter-specific guidelines? Each ICD-10-CM chapter has unique rules. These apply to categories like infectious diseases, pregnancy, diabetes, injuries, and more. You must follow both the general rules and these chapter-specific instructions. Today, we'll break down the most testable ones. Chapter 1: Infectious Diseases. For confirmed HIV, use code B20. Z21 is for asymptomatic HIV, and R75 is for inconclusive tests. Sepsis requires both the infection code and, if applicable, R65.2 for severe sepsis. Remember, urosepsis is not a diagnosis. Ask the provider to clarify. FY 2025 adds guidance to use Z29.81 for HIV PrEP counseling. Chapter 4: Diabetes. Code both the type of diabetes and the complication. For example, E11.22 is used for type 2 diabetes with kidney disease. Also assign additional codes for CKD or neuropathy as needed. If the patient uses insulin, include Z79.4. For oral drugs, use Z79.84. FY 25 rules stress linking complications correctly. Chapter 2: Neoplasms. Always sequence the primary malignancy first, followed by any metastasis. If cancer is completely excised and the patient is no longer receiving treatment, use a history code like Z85. Ongoing treatment? Use the active cancer code. FY 25 clarifies post-treatment surveillance coding. Chapter 15: Pregnancy, Childbirth, and Puerperium. Chapter 15 codes always take sequencing priority. Use a code from Z3A _ to indicate the weeks of gestation. Complications like gestational diabetes or anemia must be coded specifically. FY 25 emphasizes correct reporting of sepsis, drug use, and adverse effects in pregnancy. Chapter 9: Circulatory System. Use combination codes when possible. I10 for essential hypertension, I11 when there is hypertensive heart disease, and I12 for hypertensive CKD. Add codes for heart failure or CKD stage when necessary. Chapter 10: Respiratory System. For COPD, use combination codes like J44.0 for COPD with acute bronchitis and J44.1 for COPD with exacerbation. Asthma with exacerbation equals J45.901. For vaping-related conditions, review all related symptoms and exposures. Chapter 19: Injury and Poisoning. Injury codes require a seventh character. A equals initial encounter. D equals subsequent. S equals sequela. Fractures must be coded for type, site, and encounter. Differentiate poisoning from adverse effects. Poisoning includes overdoses, wrong drug, or wrong route. Chapter 21: Z-codes. Z-codes capture preventive care, screenings, social risks, and personal history. Common examples: Z00.00 equals general medical exam. Z23 equals immunization encounter. Z55 Z65 equals social determinants like homelessness, low education. FY 25 confirms that nurses, social workers, or therapists can document SDOH. Other important chapters. Chapter 5: Mental Disorders, Link Substance Abuse and Related Complications. Chapter 6: Use G89 codes for pain syndromes. Chapter 12: Ulcers must be coded by depth and stage, nurses can document stage. Chapter 18: Use symptom codes only when no diagnosis is confirmed. Chapter 20: External cause codes can never be reported as the primary diagnosis. FY 25 highlights. The FY 25 updates include new guidance on Z29.81 for HIV PrEP, expanded support for using SDOH codes, clarified rules for sepsis, post-procedural complications, and linking etiology and manifestations. Make sure you're using seventh characters, laterality, and gestation codes correctly. Summary. To summarize, each ICD-10-CM chapter has unique rules that modify how you assign and sequence codes. Pay attention to combination codes, manifestation links, and special coding notes. These will appear in your CPC exam, especially in clinical scenario questions. Coming up tomorrow. Great job reaching day 28. Next up is days 29 and 30, where we'll complete full CPC-style mock exams and share a final review strategy. These will help you simulate real exam timing and refine your approach. Let's finish strong.